Welcome back to Casey Cares, Kansas City's window on the nonprofit community, and we are the nonprofit voice. We want to tell the stories of the people behind Kansas City's great nonprofits that help so many in our community. I'm Ruth Baum-Biggis. February is Heart Month, Heart Health Month, focusing on everybody. Everybody has a heart in terms of your physical well-being. We won't get into whether you have a heart for other people, but everybody has a heart and they need to take care of their heart. So what better time to have the American Heart Association, Kansas City, on the show to talk about heart health and everything around our cardio person. We have Dieta Lee, who's communications director here in Kansas City. Welcome.
Hi, thank you for having us.
And we have Stephanie Liniger, who is a cardiac nurse practitioner from Advent Health.
Thanks for having me.
Welcome. A little funny aside. So when we were putting the show together and I was getting information, it says, oh, Stephanie Liniger's coming. She's an NP. Well, everybody in their particular field has different reasons behind different initials. I'm going, NP, let's see. She's a nonprofit professional. No, of course not. She's a nurse practitioner. Heart health. Tell us about this being American Heart Month, I think is the official title, Dieta. It's got a history.
That's right. It does. It is a nationally recognized holiday event. And while we try to focus on our hearts year round, February is American Heart Month, and heart disease is the #1 killer of Americans. So this is the month that we really try to hone in on heart health.
It's interesting that whoever created this back in the 60s had the foresight, oh yeah, Valentine's Day. Everybody's thinking about hearts. Well, why don't we jump on the bus? How has this grown since its inception? If you can paint a little picture of what that looks like from your organization.
Yeah, I think that it's just continued to grow. As far as the American Heart Association goes, we hold events all year long, but we really do focus on February, and there seems to be more and more focus on heart health, recognizing survivors, really that proactive approach and what things can we do to take care of your heart, not only this month, but all year round.
I was reading some of the statistics that your organization puts together. It's the #1 killer of both men and women. Kills more people than all forms of cancer combined. 1 in 3 women and 1 in 4 men will die of heart disease and stroke. Over here, Miss Nurse, what's going on? Why are these numbers so big?
Well, I think part of it is just our overall society. Everything has been made more convenient for us. And so we are much less active than we used to be, where we used to be working out on the farms, tilling that ground. And now we have big machinery. I was walking through a hotel the other day, and I even saw like a kiosk that was a CVS kiosk. So you didn't even have to leave the hotel to go get your Tylenol. Everything is just so convenient, and we're not as physically active. And I think as time goes on, as we get older, that's just making the situation worse because we're not taking care of our bodies.
That seems kind of like an oxymoron in a way, because if everything is more convenient, shouldn't we have more time to be out there doing things?
That's true.
But is there any kind of research that you can share? I mean, we can speculate all day, but I wondered if there's hard numbers why, with all the convenience in our world, we're much lazier. We're not out moving.
Yeah, I don't know I can't quote a specific study, but I think it just goes to our lives are moving so fast. We don't take time out for ourselves. I hear all the time when I'm counseling patients about preventative measures. Oh, I am just so busy. I do not have time to do a workout or go for a walk. And me being a full-time working mom and wife, I understand that.
You get that.
But I always recommend to people that they look at their schedule because there's always time in the day. It's just how you schedule it. So I tell people put it on your calendar like it's an appointment that you need to go to, a dentist appointment or a hair appointment or a kid's activity. And that's on your schedule, and you know that's when you're going to do your workout, and therefore you get it done. Because if we just leave it to, oh, I'm going to do it in the morning or I'm going to do it after work, then things happen. And you just really need to make it that important that it goes on your calendar and then you keep that appointment.
What are the top 3 or 5 things, maybe simple things, that we could be doing to help ourselves live longer and take care of that heart, which is a very complex organ?
Yeah. So I think, it goes back to what we're putting in and then what we schedule ourselves as far as activity and exercise. And I think we also have to look at our stress levels because we're all so busy, really finding that time or making sure that you're working in your schedule something that you enjoy. Because if you can do that and find joy, then you're going to have less stress. Nobody can get rid of stress, unfortunately, but we can learn how to handle that stress and cope with it better.
Managing it.
So if you have something already incorporated into your life that you enjoy. Now, of course, I'm one that's a big supporter of exercise because when you exercise, you get your endorphins going and you just feel so much better. But it can be something as simple as when I drive to work, I listen to whatever music I want to listen to in my car. Mm-hmm. I've had patients tell me they just take 5 minutes before they go into work and they might read some scripture. Sometimes
or breathe.
Or just breathe. Yeah, I think when we talk about relaxation and finding time for ourselves, people think about maybe meditation and how I could never do that. I can't slow down enough. It doesn't have to be something so Zen-like. It just has to be something that you enjoy. So
Something
if that's
that you
fishing,
do.
if that's having coffee with a friend, whatever it is that you enjoy, just make sure you're getting it in your life.
So if you're going to that local coffee shop, don't wait in the line. Run around the building 3 times, right?
Well, you'll have
and
time.
then come in.
We have started doing walking meetings at work. And so
That's
I
a cool
schedule,
idea.
I know that when I meet with a certain individual, we always do a walking meeting. And we spend a whole hour meeting about ideas and whatnot. And we've found that a lot of ideas come from when we're walking. And so it's a great way to get those steps in.
That is a great idea. What are the other things that your organization does in Kansas City? You have a huge ball coming up.
We do. We have the Kansas City Heart Ball coming up at the end of the month, and we'll have about 1,000 people at that event. So we're really excited. But there's a lot of things that we do throughout the year. The American Heart Association has ensured that all Kansas and Missouri students know hands-only CPR as a graduation requirement. So that's just creating a community of lifesavers. We've been a part of the T21 ordinances that require you to be 21 before purchasing tobacco products.
That's a tough one.
It is. And working to improve quality early education. There's so many things that make up good health. And so it's a really complex issue when we look at, why we're not at optimal heart health and why, more people are still dying of heart disease. It's a really complex issue. And so we are looking at what are those factors and how can we improve the health of Kansas City.
In your work as a nonprofit, it sounds like you really rely on some important partners. I'm looking over here at our nurse practitioner, Miss Stephanie. Are you out crafting those? How important are these health organizations, hospital systems, in what you do and getting the word out?
Absolutely. We work with a lot of different organizations and hospitals across the metro. Advent Health is our presenting medical sponsor for our Go Red for Women movement here locally. So we are constantly building those partnerships. And, the American Heart Association can't do this alone. We really do need those partnerships. We need individual volunteers, donors to really help support the work that we do.
Where can people go to find out how they can help you? Sign up, get out there, help educate, exercise, whatever.
Absolutely. Heart.org/Kansas City is a great resource to learn about what's happening locally, how to get involved. If you're looking for a heart healthy recipe, you can also find that there. So it's a really great website, and that's heart.org/Kansas City.
That would seem like an easy one to remember. I want to go back, since we're sitting here, 3 women, and we're talking about heart health and just looking at the statistic of 1 in 3 women. What are women not doing? We talked about the tips. I get that. But why is it that it's just exponentially grown for women?
I think for women, a lot of times they are the caretakers of everyone, and they are so busy that they don't stop and recognize their own illnesses that they have and kind of power through. We are getting better as a medical community as far as recognizing women and heart disease, because for a long time, women symptoms were not recognized in the emergency room when they had complaints, because they're different than they are for men.
What are they?
So a classic textbook symptoms would be heavy pressure in the middle of your chest, radiating down your left arm or to your jaw, possibly feeling sweaty, having even a sense of impending doom or feeling short of breath. And not that women can't have those symptoms, because they can. And you don't have to have all of the symptoms at the same time. Right. It can be any combination. But oftentimes women have more vague symptoms, which are difficult to identify. So it may just be that they are noticing that they're more fatigued. Well, how many people aren't complaining of feeling fatigued because of our society today, and we're constantly going? Sometimes it's upper back pain maybe that a female might be experiencing. Maybe shortness of breath without chest pain. And so then they're kind of confused about, well, maybe it's just because I'm out of shape and I need to exercise more, but I don't have time to do that. So we are getting better at recognizing the differences in women. And I always express to all the patients, you know your body best. Pay attention to trends. So if you notice that you're having discomfort after walking to the mailbox and getting back inside, but it goes away pretty quickly, and sometimes that's how it starts, and we just kind of like, oh, okay, and you move on. But then as the weeks or months go on, you notice that now then you can't even make it out to the mailbox without having that symptom. That's a change in the symptom. If it's more frequent, if it's lasting longer, if it's taking less exertion to bring that discomfort on, that's something you definitely need to speak with your provider about and get it checked out before you end up in the emergency room with the big heart attack.
Is there some kind of test that we all should be getting? Any kind of a base exam or anything to know if you are at higher risk of a heart episode of some kind?
Right. So as far as the risk factors for heart disease, we want to make sure that your blood pressure is staying well controlled, that your cholesterol is being well controlled, that your weight is at its optimal, and that you're getting the recommended amount of exercise, which is about 150 minutes per week, which sounds kind of like a lot, but if you break it down, 30 minutes 5 times a week, and you can't start out that way, that's fine, but it's a building block to get up to. Mm-hmm. You can have all of those types of screenings done just at your primary care physician. I think a lot of people don't establish care with primary care because they think they're fine, they're healthy, but it's really important to have that contact person to monitor those things for you on a routine basis and catch those changes early. Once people start having symptoms or have a really strong family history, and then maybe now they're diagnosed with some diabetes and they do have high blood pressure, there are some screening tests that patients can do. Just, having that office visit. If you're having symptoms, sometimes your physician may order a stress test to get a better understanding of your heart health.
As a patient going into your doctor, should you be saying, I don't know if I have symptoms. Can we do a baseline cardiogram or something like that? Is that what's maybe needed today?
Sometimes
if your insurance covers it.
Sometimes it can be tricky with insurance. So usually we have to have some type of symptoms. But if you have concerns, if you have a strong family history, and you know that your blood pressure is going up, sometimes you can have something called a calcium scoring test done that helps risk stratify and help your provider decide if you need to be on a medication route or what lifestyle modifications you really need to focus on.
The Heart Association, what's the greatest challenge that you all face as a nonprofit here in Kansas City? That was a big one.
That was a big question. I think, we could always use more resources, more volunteers. We had $2 million of meritorious research that went unfunded last year. And so just knowing that there could be a cure through one of these research projects, we just continue to need more funding to ensure that we are checking those all out and continuing to do the good work.
Are most of those research projects done here? In other words, if I donate to American Heart Association and I want it to go to up-to-date, research, is it staying here or is it going wherever that research is going on?
Yep. So we actually put more dollars into research in Kansas City than we fundraise. So that's pretty neat. That's kind of the great thing about being part of a national organization. So while, we are able to really put dollars into research that's happening here in Kansas City.
So don't forget your heart. Take care of yourselves. I know people always we're all on the go. February's been the month, but you know what? There's 11 months of the year. It sounds like you're telling us you better be on the watch out. And I know you like to share stories. So could folks reach out to you if they have a story of hopefully success in dealing with their illness?
Absolutely. We are always looking for spokespeople to share their story. We hear so many times, I saw so-and-so on the news and they told about the classic heart attack symptoms in a woman and that saved my life because I went and got help. So we love to hear those stories. We love to share those with the world.
Well, Deetta and Stephanie, thank you so much. Well, pay attention to our hearts.
Thank you so much.